Hi, and welcome back. If you're using AI documentation, here's one of the biggest lessons that I've learned just starting out here with this stuff. The quality of your AI note depends on the quality of the information that it hears. Many nurses think better AI notes come from better software, but often better AI notes come from asking better questions. So today I'm going to share 10 questions I ask during my visits to help uncover the information that Medicare reviewers are wanting to see, and it helps the AI create a stronger narrative. So let's get started. Before we jump in, remember this. AI can not document information it never hears. If you ask vague questions, you'll often get vague answers. If you ask specific clinical questions, you'll usually get those specific clinical information into your note. These questions are designed to support clinical thinking rather than replacing it. So question number 1, what makes it difficult for you to leave your home? One of the biggest documentation weaknesses is vague homebound status. Instead of documenting patient homebound, you want details, follow-up questions. Do you need assistance leaving the home? Did you use a walker or cane today? What happens when you try to go outside? Do you become short of breath? Are you afraid of falling? Example response. I can get to the mailbox, but I have to stop and rest because I get winded. And this is very useful information. Question number 2. Since my visit last, are you better, worse, or the same? This simple question helps to establish progress. Many notes describe today's condition, but never compares it with the previous visits. So follow up by, what's better? What's worse? What have you noticed? This helps AI capture progress towards goals. Question number 3. On a scale from 0 to 10, how would you rate your pain today? Numbers are very powerful. Instead of patient reports pain, you get patient reports right knee pain 7 out of 10 with ambulation. Specificity strengthens that documentation. Question number 4. How far can you walk before you have to stop and rest? This question often uncovers valuable functional information. For example, about 20 feet before I have to sit down. Now you have measurable data. So follow up. Is that farther than last week? Do you become short of breath sooner? Does pain limit you? Question number 5. Have you noticed any new symptoms since your last visit? Since my last visit. This question often reveals important clinical findings. For example, I have increased swelling. I have more shortness of breath. I have more dizziness or fatigue or weight gain. Patients don't always volunteer these details unless they're asked. Question number 6. Can you tell me in your own words what we discussed today? This is a good teach-back question. Instead of documenting purple verbalized understanding, you can document patient correctly explain the signs of worsening congestive heart failure or physician notification parameters, when to call the doctor. That's much stronger evidence of learning. And then question number 7. What is your biggest challenge right now? This question frequently reveals barriers to progress. Examples? I have difficulty remembering my medications, or I have trouble following the diet recommendations you gave me last week, or limited caregiver support, or fatigue, mobility limitations. These all challenge how often, we explain why skilled nursing remain getting tongue-tied here. These challenges often explain why the skilled nursing remains necessary in the home. Question number 8. Have you missed any medications or had any trouble taking them as prescribed? Medication adherence is a common issue. Patients, they often hesitate to bring this up unless directly asked. So examples of this is Possibly, well, I missed some doses, or I have some confusion about my schedule, or running out of medications, or side effects that they might have. This can lead to important teaching opportunities. Question number 9. Have you had any falls, near falls, or situations where you almost lost your balance? Many patients don't report near falls unless specifically asked. This questions help to uncover safety risks, mobility issues, and need for additional interventions. And it also helps to support continued skilled assessment. And then the last question number 10. What would make you call your doctor or seek medical attention? This may be the most important teaching question of all. For a congestive heart failure patient, weight gain, increased swelling, shortness of breath. For a diabetic patient, signs of low blood sugar, elevated blood sugars. For wound patients, increased drainage, redness, fever. The answer tells you whether the patient understands when to seek help. So, putting all of this stuff together, notice something about these questions. None of them are really that complicated, but they do something very important. They pull out the details that often get missed. The pain score, the ambulation distance, the symptom changes, the teach back, the barriers to care. Those are the details that help demonstrate skilled nursing services, and it helps the AI create a more complete narrative. So in closing, remember, AI can only document what it hears. If you want better AI-generated notes, start by asking better clinical questions. The goal isn't to talk more. The goal is to uncover the information that really matters in the visit. If you like the complete clinical thinking system that I use during home health visits, download the free guide. In the channel description or on the channel itself, I use it to gather the information needed for stronger documentation and better AI-generated narratives. And let me know in the comments what questions you ask that consistently gives you the most useful clinical information during your visits. I'd love to hear what you have to say. Well, I hope this has been a benefit for you. Consider subscribing and look forward to seeing you on the next one. Have a good day.